Okay, here are our weekly numbers for this week. So fortunately, as you can see, our active cases in Clay County have jumped up a bit, over 100 cases. So that's not great. And then our active cases in Minnesota also jumped up around 5,000 cases. So we're seeing the increase in Minnesota and in our Clay County region. Our active cases in Cass County just slightly went down, 15 cases, so not a significant decline. And then the active cases across the state of North Dakota did go up just a little bit as well. Our active cases by age, so you can see again, the 5 to 9 year olds are kind of the leading the active cases by age, and that was similar to what we had last week as well. So that's those cases have been continuing to increase by age. Then we have the cumulative cases, which is throughout the pandemic. Our total cases now are at 11,068. Last week they were at 10,717. So still seeing the age range of the 20 to 24 year olds in that cumulative age range. Then it's our cases per week, starting from July, so you can see up to our current of October 31st. You can see the cases per week that are being reported as well. And this is the cases since March of 2020, the overall cases. And you can see now, as we're seeing the increase in numbers, they've been up and down in October. So as the length of this wave is extended, we're also seeing the fluctuation of the cases as well. And then we'll go to Becky.
Good morning. So this is the graph that's put out by the CDC every week that shows the level of community transmission. So as you can see, the entire state of Minnesota is once again at that high level of community spread. Last week there was one county that was at moderate, that yellow color, and now that has also increased to high spread. We did unfortunately have another death reported to us the past week. So our total number of deaths throughout the pandemic for Clay County is now at 100. And then this is the graph that depicts the number of COVID hospital admissions per week for Clay County residents. So we are starting to see another increase in hospitalizations, which is typical after we see a rise in reported cases. So usually hospitalizations are what we refer to as a lagging indicator. So we'll have a spike of cases, and then usually 2 to 3 weeks later, we'll see that increase of hospitalizations. So you can see for last week so far, the number of reported hospitalizations is at 11 for Clay County.
I have a question quick, Becky. Are those unduplicated numbers, or if someone is in for 3 weeks, are they showing up for the 3 weeks? Those aren't new admissions, right?
Correct, it's per case.
So if I was in for 3 weeks, I would be one in each of those weekly categories.
Right, so it goes by the date of admission. So if you were admitted, let's say October 15th,
right,
and you were in there for 3 weeks, your number would just show up for that week of October 15th.
Right. So then if we've had 96 hospitalizations basically since August 1st, is there any way to know how many individuals that is?
Yes, there is. The hospitalizations are you referring to the next slide?
Yes, maybe where I'm going with that question is, one, what is the Clay County total hospitalization since we've had this surge in August, basically? And then just to kind of get an understanding maybe of what a current hospital stay is for those individuals.
Sure, and I mean, those are numbers that I could get. There are a lot of times it's lagged, so it's hard to tell. So we get, admission dates and then discharge dates as well.
I think it's not so much that I'm curious because I want another page for information, but I think it would be an interesting piece of information to know.
Sure.
Thank you.
And then this slide just breaks down the recent hospitalizations of Clay County residents by age. So as you can see, a majority, 56% of those that have been admitted to the hospital during this latest spike of cases since August 1st have been under the age of 65. And then the bar graph on the right shows the breakdown of admissions by age group. And we have had a total of 94 cases admitted to the hospital since August 1st. And then this is hospital capacity for our local healthcare systems in Fargo. This continues to be a concern, as you can see by these numbers here. So at the time of this report, Ascension Fargo had no staffed ICU beds for adults or pediatrics. Sanford had 2 adult ICU beds available and 1 pediatric ICU bed available. The VA had 1 adult ICU bed available and then 11 regular adult beds available. So total statewide ICU capacity for North Dakota as of yesterday was 5 available beds and 3 pediatric ICU beds.
That's for Fargo.
So this graph here is for our 3 healthcare systems in Fargo, but the statewide availability was 5 beds throughout the entire state for adults and 3 for pediatric.
Mr. Chair.
Yes, Commissioner Keeley.
Do we know, does the VA take overflow from like Sanford or Essentia for non-veterans? Would they take somebody from the general population?
I don't know.
Yeah, I'm not sure about that. We can certainly ask the hospital systems if that's a plan.
Because they have 11 and Essentia
Right.
has 0, you know? Curious, thank you.
Right, yeah.
I did hear something this week that the VA was giving booster vaccines to veterans and had the availability to do flu shots to the spouses of veterans, but could not do the booster shots to the spouses of veterans. So I would think that the service piece would end with those that are not members of the veteran community.
Yeah, I would think so, but not sure about that.
And then this slide shows statewide hospitalization for North Dakota as of yesterday. So there was currently, as of yesterday, 148 hospitalized due to COVID, with 16 in the ICU. Last week, the number hospitalized was at 170, and the number in the ICU was 16. So the number of hospitalized COVID patients in North Dakota that are in the ICU has remained about the same, but the general admissions has gone down a little bit from last week. And then the chart in the middle shows hospitalizations broken down by age. So as you can see, there is currently 1 pediatric patient hospitalized for COVID. And then the chart on the right breaks down total admissions by age group throughout the pandemic. This is the updated graphic from the Sanford healthcare systems. So as you can see, we continue to see the same trend week after week. The red people represent those that are not vaccinated, and the white represent those that are vaccinated. The overwhelming majority of hospitalized cases continue to be among those that are not vaccinated. 32 of the 33 patients on ventilators are not vaccinated. And then breakthrough cases, this is updated weekly by the Minnesota Department of Health. Again, seeing the same trends where percentage of breakthrough infections are negligible, so we're at a little over 2%. Breakthrough hospitalizations even less at 0.092%, and breakthrough deaths at 0.015%.
Again, does this include the Fargo hospitals?
I believe so. So it would be any,
Information out of the Fargo that might have Clay County people?
right, so it goes by residency. So if a Minnesota resident is hospitalized out of state, they would be included in that, correct?
Commissioner Ebinger.
Is there being an effort made to track any variance in a breakthrough case between people who have received a booster and people that have just had the initial immunization?
That I'm not aware of. I know some testing companies are sequencing test results. I know Vault is one of them. So you know, if you are tested at the vault site, those results are sequenced. But I don't know if specifically if they're looking at booster, you know, breakthrough infections for people that have had a booster dose.
I just
Is that your
wonder-
question?
Yeah, it just seems that would give some track of the efficacy of the booster.
Yeah, we can certainly follow up with MDH and see if there's any tracking of that.
Yeah, I mean, and again, to echo Commissioner Mojo's, I'm not looking for another page in the report.
Yep.
It just seems that would be a useful bit of information on people who are considering getting a booster but aren't doing so because of other concerns.
And you know, it's Commissioner Ebinger and Mr. Chair, it's, you know, the Moderna boosters and the J&J boosters, you know, just got started, so it might be a little early, you know, to track those. The Pfizer booster was out, so not sure where they're at with that, but it might be something we'll certainly check on.
I did notice, just an aside on the docket website I got a booster 3 weeks ago, 4 weeks ago, still not reflected. So I don't know if that, and it was from a pharmacy in Minnesota, so I don't know if that information's not getting through or it's not getting updated, but
That's a little bit of a
they
delay.
may be losing some data there if they're not getting it in.
Becky, I have a question. I look at the cases per week, and I look at where we were on the 31st of October with 291 cases, and I compare that to July 18th of 4 or 6. 6. And is that, how do we get there? How do we get from being down? Is this a result of the Delta variant, or is that about when that thing started showing up?
Yes, yeah, we saw these trends start earlier in the southern states, back in, I think it was the end of July, sometime, you know, during the summer months where we started to see case trends go up in the southern states, and then we lag usually a little bit behind them and had started to see the same trends. So, yes, everyone is referring to this as the Delta surge.
Okay.
Okay. Good morning. The next thing we'll look at is the statewide vaccine data as of November 4th. And they added now with the 5 and over, because as of last week, the 5 through 11 are able to be vaccinated. So that did bring our total percentages down from 73.8 last week for the number with 1 dose to 66.9%. So that's what that dip is because of that. And then those that had completed the series, the 70.3 was what we had last week, and now we're at 63.8. But if you look below, they're now tracking those children from 5 through the age of 11, and there's 1% of the eligible in the population that have received that first dose, and not the second dose, of course. And so that's basically what we're seeing is the data numbers are a little bit different because of the fact that we've now started to vaccinate the 5 to 11 population.
So those are percentages based on eligible.
Yes, exactly. So we feel like we keep going backwards because of the age group dropping, but that's a good thing that we have them eligible. So then looking at the Clay County Public Health doses, our total as of last week, 16,539, and we vaccinated 720 last week. And we had opportunities for additional appointments. So we are continuing to do scheduled appointments, but we don't turn people away because there's always people that no show for their appointments. So we squeeze them in, but we're not advertising for walk-ins. It becomes more paperwork, basically, that has to be entered. So, but we don't turn anyone away. So it was a busy clinic. It was our first clinic in the Family Service Center using the ITV room, and I think it went really well. We had a good number of staff and opportunities for people to have the 15-minute wait, lots of seating, and so it went very well. We've got a lot of compliments on that.
Jamie, are you tracking those that are getting the first and second dose versus the booster in that
Yes,
720?
yes, we are, yeah. And we do offer both, all three, every time. So I will talk about what we're doing this week. First of all, the 5 to 11 population, the students, the children, we will have vaccine available after the 16th. So next week, we'll have vaccine available. Tentatively planning, we're going to do an after-school and to the evening clinic at the Family Service Center. We're going to start with that, see what the response is to that. Again, we talk about that we meet with the superintendents every week, and we've talked about we will meet the need as there is a need. Sounds like some of the schools are being reached out to by the pharmacies too, so they're taking advantage of those opportunities as well. But this week, we have a clinic today. Our clinic is from 12 to 6 o'clock at the Family Service Center, and we're offering the Moderna and Johnson & Johnson vaccine boosters. And then we're also offering the first and second doses for each of those vaccines. And that's it.
All right.
Mr. Chair, we also handed the testing activities for the vault testing site. And we've mentioned before, they added the rapid test, which was a great addition for those on the Clay County side. So they can get a rapid test as well as the PCR test. So we see a little bit of an increase in the number of people that are availing themselves to that testing site. They are still accepting North Dakota residents as well as Minnesota residents. Were going to the Fargo site for rapid testing when we didn't have that. So it's a good thing to have it on this side of the river. So we'll see probably the numbers continue to go up as testing increases.
I noticed here on the week of October 24th, 12.98% positive
Yep.
compared to 7 and 2 weeks before.
Right. Yeah. Which, as we know, the Delta variant is circulating pretty significantly still. And we also have, if you notice in there, the non-Minnesota residents of 230 and then the Minnesota residents of 583. So yeah, the percentage of positivity is up a bit.
I had a family member that went there last week to get the booster shot. He was very complimentary of how it worked. It was how well it was organized and stuff like that. So he must be running a good shop of it.
Thank you.
All right, any other questions? Thank you.
Thank you.